axis bow transfer. The axis bow transfer is accomplished by first performing an ear bow and providing that assembly for the axis bow transfer. The ear bow is a separate procedure. Seen here is the bite fork from the ear bow, and now it is attached to the cross rod specifically designed to perform the axis bow transfer. Note there is a flat spot on the ear bow assembly, and it is positioned so that the clinician positions the cross rod with the Panadent logo up. The sidearm assemblies used in the hinge axis location are again used in the axis bow transfer and subsequent mounting of the casts. The stylus is adjusted so the tip is just beyond the end of the brass tube. The stop is moved just to the edge of the ruler, allowing about a 6 mm extension. This allows the clinician to move the sidearm as close to the patient as possible, yet keeping it centered. Once in position, the macro adjustments are made to position the stylus over the tattoo. The gross vertical and horizontal trajectories are established, and the macro set screws are tightened to prevent tipping at an inopportune time. When the styli are finally in position, use the hex screwdriver to tighten the vertical macro screw firmly. Again, take great care to be very passive with the positioning of the hair so the tissue isn't stretched. It is also important that your patient does not laugh or talk because a smile can change the position of the tattoo as well. As one can see in this scene, the up and down microscrews are used to move the stylus over the tattoo. It is easier positioning the stylus over the tattoo than it is to find the hinge axis location initially. Once one side is established, proceed to the other side and repeat. It is very important to go back and check the position of the first one to make sure that both sides line up on the tattoo marks simultaneously. In this scene of the left side, one can see the clinician sliding the sidearm in and out as well as moving the positioning up and down. When close, the vertical macro screw is snugged but not tightened. The micro adjusting screws on the end of the sidearm and the two screws on the lower side of the apparatus are used to zero in on the tattoo. Again, it is extremely important to have the patient in a passive position to assure no distortion. Having the patient twist her head just a moment ago was more for the camera and less for getting a true axis bow transfer accomplished. As can be seen, to accurately achieve an axis transfer, the hair is gently moved out of the way, not distorting the tone of the tissue or stretching the tissue. While this doesn't make for a very good camera angle, it is necessary to be accurate. When the styli finally are in position, use the hex screwdriver to tighten the vertical macro screw tightly. From this point on, until the final articulation of casts has been completed, treat the axis bow transfer assembly very gently. If it gets bumped, there will be no way of knowing if it has been bumped, and the mounting will be inaccurate. Unless the axis bow is secured to its axis mounting plate immediately, it is suggested that a high shelf out of the way be provided to store this assembly to prevent inadvertent bumping.